Hello, my friends. Today I would like to talk to you about a very important topic, a very disturbing topic, depression. Firstly, I would like to give you a statistic. This is based on my research in Google and the information I have gathered from here and there. Depression is a common illness worldwide, with an estimated 3.8% of the population affected, including 5% among adults and 5.7% among adults older than 60 years. Approximately 280 million people in the world have depression. Um, well, almost all ages are affected by depression, except toddlers between 3 to 5 years. It's very rare. Children between 6 to 13 years, very common. Teenagers 14 to 18 years, very common. Young adults 19 to 40 years, very common. Adults 41 to 60 years, very common. Seniors 60 years and plus, very common. People may experience anxiety, apathy, general discontent, guilt, hopelessness, loss of interest or pleasure in activities, mood swings or sadness. They become agitated, they cry excessively, they become very irritable, restless, and socially isolated. Their sleep patterns may change. Their body may have excessive hunger, fatigue, or loss of appetite. They lack concentration, slowness in activity, or thoughts of suicide. 5 most common signs of depression are persistent, depressed, low mood. It's natural to feel from time to time, but not always. Loss of interest in things you once enjoyed. Sometimes we lose interest in things we used to love. Feelings of worthlessness, poor concentration, thoughts of harming yourself. The symptoms: feelings of sadness, tearfulness, emptiness, or hopelessness. Angry outbursts, irritability or frustration, even over small matters. Loss of interest or pleasure in most or all normal activities such as sex, hobbies, or sports. Sleep disturbances, including insomnia or sleeping too much. 10 common depression symptoms: feelings of helplessness and hopelessness, loss of interest in daily activities, appetite or weight changes, sleep changes, anger or irritability, loss of energy, self-loathing, reckless behavior. What causes depression? Stressful events such as trauma, divorce, bereavement, or relationship breakdown. Most people take time to come to terms with stressful events, but many don't. Personality, family history such as genetics, giving birth, loneliness, alcohol and drugs, illness. In the long run, alcohol and drugs worsen depression and make it harder to treat. If you can't stop drinking alcohol or using drugs on your own, talk to your doctor or mental health professional. Depression treatment may be unsuccessful until you address your substance use, manage and control your stress. Medications and psychotherapy are effective for most people with depression. Your primary care doctor or psychiatrists can prescribe medications to relieve symptoms. However, many people with depression also benefit from seeing a psychiatrist, psychologist, or other mental health professional. Okay, having said that, I have also made my own notes based on my research. In my opinion, we all have to some degree some signs of depression, but our tolerance level is different. We must find someone strong who we trust, whose level of depression is much lower than us, to help us. The best thing to do is to listen to someone who is depressed and acknowledge that they have depression and let them know that they are not alone. Good advice we can give them is to control their emotions. Make them understand that they are very, very special. Finally, teach them to love themselves every minute they live. And now I would like to give you an example of Forrest Gump. You have probably seen the movie. Forrest Gump may have had a very low IQ, but had a kind heart. We saw him in the middle of battlefield with bullets, grenades, and bombs flying around, but helping other wounded soldiers. We must understand that depression is a great disability, and depressed people may not be predictable. And depressed people may not be predictable in their behavior. Depression does not go away overnight. So we must expect this pattern to occur over and over again, whatever the pattern is. Their anger issues, their whatever. We should not give up. We should never give up or ignore the depressed person. We should always pay attention. We must always be there for them. We must always listen to them. We must always acknowledge that they have depression. And the best advice we can give them is just love yourself. Don't harm yourself. Do not do anything harmful. Thank you for listening to me.